Hi, everyone. Thanks so much for joining us today. We're going to get started very shortly. We're just going to give people a couple more minutes so that they can arrive. We'll be back with you in a moment. Good afternoon, everyone. My name is David Block, Physical Therapist and Regional Director at Spear Physical and Occupational Therapy. I'd like to welcome back those of you who have attended one of our other webinars, as well as welcome those who are joining us for the first time. This is our first Recovery from COVID webinar, and we're excited to be back with all of you today. We appreciate you taking time out of your busy days to learn with us. For those of you who do not know who we are, Spear is a private outpatient practice that has been around for about 20 years, with currently 20 locations located all over the New York City area. We have successfully continued to offer in-person care through the COVID-19 pandemic, as well as have launched Spear Live for those who are looking to stay in and receive care using our telehealth platform from the comfort of your own home. In our clinics, we're strategically going above and beyond the CDC guidelines to ensure the safety and well-being of everyone. You can find more detailed information on those safety measures by visiting our website at spearcenter.com. We're here for you in whichever way makes you feel most comfortable. If you're looking for individualized care, either in the clinic or through telehealth, please reach out to us at your convenience and we'll get you set up for an appointment right away. As part of our session today, we'll be talking through and demonstrating some exercises, and we welcome you to follow along and practice with us as you feel comfortable. Please note, if you experience any pain or discomfort while performing any of these exercises, please stop and reach out to us directly so that we can support you. We created today's talk specifically for you and are coming to you live from our own homes. We don't anticipate any technical issues today, but please be patient with us should any issue arise, and we'll make sure we navigate appropriately. So as I mentioned throughout the webinar, we want to hear from you. If you have any questions, please feel free to let us know your thoughts in the Q&A feature. To find where that is, please take a moment to hover your mouse at the bottom of your screen. You'll see a Q&A option pop up. That is where you'll put questions, and we'll do our best to address as many as we can throughout the webinar. It's best practice to put questions in the Q&A. If you put questions in the chat feature, we will likely be unable to get to them during the webinar. So again, please make sure if you have questions, we want to hear them, put them in the Q&A feature. For those of you who are watching through YouTube Live, we're monitoring the comments section there as well. So please feel free to type your questions in. Lastly, there's going to be times where multiple panelists are on the screen. For the best viewing experience, please select Gallery View at the top right corner of your Zoom screen. This will enable you to see all the panelists that are on the screen at one time. So let's talk more about our goals for the day and what we're going to be covering. So our primary goal today is to get you up and moving after you've had COVID and get you back to life. We're going to teach you some stretches and breathing techniques that you can perform at home. And lastly, we're going to teach you how to safely monitor your heart rate and how to return to your normal exercise routine safely while recovering from COVID. Before we get started, I'd like to introduce our team of panelists. We're going to welcome everyone onto the screen now. If you can see everyone on the screen, you're in optimal webinar viewing experience, aka gallery view. Again, top right-hand corner of your screen, click gallery view, you'll be able to see all of us. So, without further ado, first up, our first panelist, we have Eric Finkelstein. He's a physical therapist at our West 75th Street location on the Upper West Side.
Hey guys, how's it going?
Next up, we have Bianca Ambrosino, who's a physical therapist. She also specializes in pelvic health physical therapy, and she's also on our Upper West Side, West 75th Street location.
Hi, happy to be here.
Lastly, we have the clinical director of our West 75th Street location, Michelle Deerwater. She's going to be helping us in the background navigating some of the Q&A and help answer some of your questions.
Hi, everyone. Looking forward to your question.
All right, everyone. Bianca, Michelle, and I are going to say goodbye for now. Let's kick off this webinar. Eric, take it away.
All right. Thanks, David. So I'm just going to start by outlining exactly what we're going to be going through and really who this applies to most. So this webinar is for people who've had COVID, currently have COVID, or have persisting symptoms, or anyone who knows someone in those populations. So let me start by running through everything that we're going to talk about. We're going to talk about symptoms that many people have been complaining of, that we've seen in the clinic that may pertain to you. We're going to walk through respiratory and breathing techniques that'll help to improve lung function. We'll demonstrate and how and why you should monitor heart rate and how hard you're working during any of your daily activities. And lastly, we'll walk through an exercise program or a way to get back to exercise for the mild, moderate, and severe cases. So I wanted to start off by first asking you guys a question. We'll start with a poll. And it should have popped up on your screen. Which of the following bodily systems does COVID affect? So I'll run through these with you guys. So cardiac, meaning the heart. Pulmonary, meaning respiratory or the lungs. Musculoskeletal, which are muscles and bones. The blood system or the vascular system, hematologic. Or the gastrointestinal, the stomach, intestines, or digestion. Or does it affect all of them? So I'll give you guys a little bit of time to answer that. You could always assume B is the right answer, but I don't know about the case in this one. Let's give a little more time. All right, so most of the people chose all the above. Some people chose just pulmonary. So to run through that, COVID does affect all of the systems in the body, or all of the systems depicted. And so why don't we pull up our first slide just to run through exactly what the symptoms are and why that is. So on the slide here, you can see you have your most common symptoms. Your shortness of breath, fatigue, fever, cough. And even if you look down a little bit, your loss of taste and smell, which has been one of the more odd ones that people have been seeing. But you also have things that are going on in the stomach, like diarrhea. You have things like heart racing, which is tachycardia. We've been seeing a lot of people having obscure or different types of joint pain. So like in the ribs, the sternum, in the middle of the back. And so what I want to do by running through all of these is to try and normalize some of your symptoms, because while they may seem atypical, they are more typical than you might imagine. Lastly, on the bottom of the slide, one of the other things we've been seeing is neurological symptoms. So that includes weakness, sensory issues, so like numbness and tingling in different parts of the legs and the body. Some people have been having memory issues, and another one to fit into the neurological category are headaches. And so along this line, the more severe your case was, so whether you were hospitalized or had more of a moderate case, you're more you have a greater propensity to have one of these symptoms. It doesn't mean that it can't be addressed. It just means that it's more likely to have happened in someone in your place. And so I wanted to bring to light a lot of these because they might seem scary, they might seem anxiety producing, but they're rather, they're a normal atypical presentation, if you'll trust me on that one. And I wanted to let you know that we're aware of this and we're comfortable working with people in this population, who are presenting as such. So after going through the symptoms, I'm going to kick it back over to Bianca, who's going to be talking about and demonstrating breathing techniques to perform at home.
Eric, so I'm going to go over some respiratory or breathing techniques you can do at home while you have COVID or after you're recovering from COVID. So one technique that can be really useful during recovery is called pursed lip breathing. So this technique involves breathing in through your nose and breathing out slowly through the mouth. Repeated pursed lip breathing should slow breathing and empty the lungs. You can think about smelling a rose and then blowing out a birthday candle. Paced breathing is a breathing technique in which we inhale for 2 to 4 seconds and exhale for 4 to 6 seconds. Paced breathing can reduce stress and relaxation, aid in relaxation, as well as facilitate taking deeper breaths. Paced breathing is a useful technique to practice when performing activities that take more effort and make you breathless. Think about exhaling on the more effortful portion of a movement, such as standing up from a chair or climbing the stairs. Another technique is called diaphragmatic or belly breathing. Belly breathing is another helpful technique that can help to relax and control your breathing. You can perform this by sitting in a comfortable and supported position and putting one hand on your chest and the other hand on your belly. And when we perform belly breathing, as we take a deep inhale in, we want the hand that's on our belly to rise more than the hand on our chest. Try to use as little effort as possible and make your breath slow, relaxed, and smooth. So another technique that we have is called active cycle of breathing, and this technique is especially helpful for individuals who have a more productive cough or cough with mucus. Again, this is not the more typical presentation, but we have found that some people have a cough with a little bit more mucus. So in this technique, we are going to first perform 3 to 5 relaxed breaths, then 3 to 5 deeper breaths, and then we're going to perform a huff in order to try and clear mucus. So when you do this, you can think about trying to fog up a mirror with your breath. So again, we're going to perform all of these techniques 3 to 5 times, and this can be repeated 3 times to try and make your cough a little bit more productive. So I'm going to bring Eric back on the screen, and he's going to help me to demonstrate an open book stretch.
Hey again. Let's get this set up.
So gentle stretching of the chest and upper back are going to be helpful in improving chest expansion and allow for deeper breaths after COVID. So Eric will demonstrate an open book stretch for improved thoracic or upper back mobility. Eric will begin lying on his side with his bottom leg straight and his top leg bent to 90 degrees. If this is bothersome for your hip, you can leave both legs out straight as well. So both arms are going to come out straight in front of you on the ground, and then you'll slowly move your top arm away from the other arm towards the floor to the other side while rotating your trunk. It may be helpful to have a pillow under your head like Eric, so we don't have any extra stress on the neck. Now, great job, Eric. And you can perform that 2 to 3 sets of 10 on each side. So Eric's going to take it away now with some ways that you can measure your heart rate at home.
All right, great stretch, Bianca. So now I want to talk about how to monitor your symptoms, as oftentimes they're persisting for a long time. So I want to give everyone a way to measure whether or not they're improving or having any change whatsoever. And this will best give you the tools of how to challenge yourself safely. The reason why you want to monitor yourself is because of the different systems that the that COVID can affect, specifically the heart. So what I want to get into now is how to go about best utilizing heart rate and monitoring it. So what you can do, fortunately, is if you have any sort of watch that monitors heart rate, some phones can do it. Whether you have something in general, you can use that to make things easier. But what I want to do is to show you how to take your own heart rate, just in case you don't have any of those tools available to you. So I'm going to give you two options. The most common one that people see is right on the wrist. And so now, in order to take your pulse on your wrist, what you're going to do is take two fingers, walk down from the thumb on the inside of the wrist, and press in a little bit. It's easier if you're holding your wrist down like that, just because you'll be able to see what you're doing. But what you want to do is press down, not too hard, but with so that you can push the skin in a little bit, and you should start to feel a pulsation from, this would be your radial artery. And so what you want to do, you move the fingers around if you're having trouble finding where that pulse is, and take note of kind of how it feels. And in order to figure out what your heart rate is, you want to use a timer or the second hand of a clock and count how many pulses occur. So you can count it for a minute, but for time's sake, you can count for 15 seconds, multiply the number by 4 to get your beats per minute, or count for 30 seconds to be a little more accurate, and then multiply that number by 2. So again, the reason behind this is to make sure that you understand how your body's responding to different activities. So it might be helpful to take note of what your heart rate is during the day, during different activities, or just at rest. You could take a mental note, or you can make a journal if it's something that you feel like has been fluctuating, or you're not sure if the symptoms are consistent. And so one way that this can be helpful is, let's say you measure your heart rate, and it's right after and during you do the dishes, and your heart rate jumps up to 120 beats per minute. So you're probably feeling that a little bit, but you want to take note of that number, and then measure it again the next time you go to do the dishes or a similar type of activity. And if your heart rate is now 115 or 110, that means you're still getting your heart rate up, but you're tolerating the activity better. So that would indicate that you're improving. Another way that you can measure this progression or how you're tolerating different activities is just by a simple scale of 1 to 10 that indicates how hard you're exerting or how short of breath you are. So 10 being this is the most fatigued you've been, you really can't catch your breath. 1 being, you're perfectly fine, you don't really need a break or anything. So when you're doing these, you take measure of what your heart rate was, you take measure of what your level of exertion was, whether that be 4 or 5 on that scale, and you compare it as you keep trying that activity, going for a walk, whatever it is you're doing, and see if you're improving in how it's feeling, even if it's still a little bothersome. These techniques are really meant to monitor how your body's feeling and how it's healing. It can help bring awareness and possibly lessen people's anxieties about worsening symptoms when they have that objective data of, no, I felt the same way when I did this before, so I'm still okay. Conversely, it is important to acknowledge if you feel like you're getting worse, because it's another way to know that you should, perhaps go seek other advice from a medical professional. So now we're going to bring Bianca back on to talk about how to utilize these techniques and how they correspond to everyday life.
Thanks, Eric. So after COVID, our activities of daily living may be hard to complete. So tasks such as cooking, cleaning, and bathing, things that seemed easy in the past, now may make you breathless. So it's really going to be important to pace yourself. So some tips for pacing include splitting your activities up into parts, saving your energy, So if you know you have a lot of things you have to do in the afternoon, maybe having a more restful time right before that, adjusting your expectations for activities that you can complete, allowing others to help you when that's appropriate, and really slowly easing back into your activities. So I also wanted to talk about some positions to ease breathlessness. So let's say I was just up doing the dishes and now I'm really out of breath. So some positions that might be good to try are laying on your side, propped up with pillows. You can also come and put your elbows down on your knees or in front of you on a table. And then another option would be to lean with your back up against a wall. That's a really great position for once you kind of are out, again, walking in the community if your heart rate gets a little bit too high. So I'm going to bring up another poll. So in what phase of COVID recovery is it appropriate to begin light physical activity such as light jogging and cycling? So phase 1 currently has COVID. Phase 2, 10 days rest and at least 7 days symptom free. Phase 3, that's going to be no symptoms. So that is after you do not have COVID anymore and you've been symptom free. And then phase 4, at least 2 to 3 weeks symptom free. Okay. So light activities such as jogging, cycling, maybe taking a stroll around the block, maybe that means cooking dinner for the first time in a while or folding your laundry. Doesn't necessarily mean you have to go out for a run. Give a few more seconds to see if we can get a few more results in. So a ton of people said phase 4, at least 2 to 3 weeks symptom free. So actually, at phase 2, 10 days rest and at least 7 days symptom free, we can begin really light activity. So Eric's actually going to come on and go into a little bit more detail about what the phases are. And I'll be signing off for now.
All right, thank you, Bianca. Great poll again. So I want to, before I go into exercise, I want to give a little disclaimer and give an outline where we got this information from as well. So whenever you're going to try and get back into exercise, you should always be very cautious, especially after COVID, as there have been some cases where especially the heart has a poor response, and that's why we wanted to outline how to monitor those symptoms for when you try and go back to doing exercise. So the progression needs to be very gradual, and you really need to listen to your body. This specific guideline was based off of what a few of the doctors at the Hospital for Special Surgeries, HSS, outlined on how to go about returning to sport or returning to exercise after a mild or moderate COVID-19 case. If those who've had severe cases, I'll go into the phases in a sec, those who've had severe cases or hospitalized for a period of time, I would exercise more caution in following these without any other medical professional or guidance. So on the screen here, you could see phase 1. So this is when you just started to feel your symptoms. Maybe you just got your positive test. And what you're doing here is you're not exercising, and you're using the techniques we gave you here to monitor how you're tolerating activity, improving your breathing and your lung function, and working on your chest and postural muscles. Your exercise should not be anything more than what you need to do for everyday living, or chores, or just gentle walking, whether that's around the house or in the backyard. But I wouldn't go anything more than that during this time. Now in phase 2, in the next slide right here, you can see that's when your light exercise can begin. And when we say light exercise, you should have very minimal symptoms or none at all. And so you want to, when you're exercising at the very least. So this cannot start until 10 days of rest after your onset of symptoms. And following that, you need at least 7 days of symptom-free at rest. And so you can start by walking a little bit more, going for a walk around the block. You can do a light jogging or cycling for 15 minutes at most that I'd start here. And what I wanted to give you guys is a tool to measure how to know how much you should push yourself in this phase. So this might be a little more complex, but I wanted to give you guys the tool in case you want to use it. And if there are any questions on it, there's an outline of how to do this. We'll supply a handout at the end of the webinar, and we'll also address any questions if there's any questions on this particular topic. So we're talking about the max heart rate that you should hit when you are exercising in this phase, which is 70% of your maximum heart rate. So to calculate that, you take the number 220 and subtract your age. So this is a very rough estimate, but it's an okay way to try and gauge what your maximum heart rate will be. So for example, for easy numbers, let's say you're 20 years old, your maximum heart rate is around 200 beats per minute. And so what that means is that 70% of that, which is 140, you should not exercise above 140 beats per minute. And you can do the math on whatever your age is, but that's how you should best monitor heart rate. Again, when you're exercising, you should really try and limit the amount of exertion or shortness of breath that you're feeling, if keeping it to none at all. So now we'll go into phase 3, and what you'll do, the way you know you can progress into this is that you have no symptoms at rest, and you have very, very minimal symptoms when you've been doing the 15 minutes or so of the previous phase of exercises. And now in this phase, you're continuing to monitor your heart rate, your exertion, your shortness of breath, but now you can do a little bit more. You can increase the jogging or cycling up to 30 minutes. You can add in some resistance training, very light, start small. You can do any online classes, so yoga, Tai Chi, Zumba, any dance class. And then we can bump up the max heart rate that you can hit to about 80%. You can go lower, but you can push that mark a little bit more in this phase. So now in the last phase that we have outlined, you want to be symptom-free for 2 to 3 weeks. And so this is sort of your return to sport, your return to your normal conditioning that you do. Again, using heart rate, using shortness of breath to monitor how you're feeling. You want to really slowly and incrementally increase what you're doing. And so this may pertain to more athletes or people who are more honed in on what they do week by week. So we want to do that, but the best way to do that would be using the 50-30-20-10 rule. So what that means is that 50%. So the first week that you enter this phase, you are exercising at 50% of the workload that you were doing previously. So if you're someone that is a runner and you run 20 miles a week, you should enter this phase. You should not do anything more than 10 miles in that first week. And in order to progress to the next phase, which would be 30% of your previous workload, you need to be able to do in the 50% one, you need to be able to do that amount of exercise without any symptoms. So if you can't, in this example, if you typically run 20 miles and you are doing your 10-mile 50% workout, then you cannot progress to the next stage until you are symptom-free in that one. So, and then you keep going. So this is at minimum a 4-week progression of 50%, 30%, 20%, and 10%. So now a lot of numbers, but again, we want to really try and supply as much information as we can to give people the confidence in programming for themselves if they are trying to get back into exercise. With that being said, it's important to know that if you're nervous, if you're apprehensive or not sure of any of the symptoms that you're having, or perhaps you're just unsure, it's always okay and smart to seek assistance from your doctor, from a physical therapist, from an athletic trainer, exercise physiologist, cardiologist, whoever you're seeing, or whoever's in your care for this particular diagnosis. So after going through all that, I'm sure we'll be able to field any questions on that if need be, because it is a lot of information. I want at this point to bring up one more poll that'll ease into the next topic. So which of the following conditions have you been diagnosed with? So this is not a right or wrong. You can click one, 2, 3, or none of the above. So you have high blood pressure, also known as hypertension. You have coronary artery disease or heart disease. You have diabetes, or typically type 2, which is more of your adult onset, or none of these. So I want to just field this question to see how people are, what audience I'm really speaking to, and then we'll get into why this is an important topic. So these are some of the more typical things that people end up going to their physician to have. And so a bit of a spread. So we have some people with high blood pressure, some people with coronary artery disease, some people with diabetes, and a good majority of people don't have any, which I would say is more of it's good. So the reason why I brought those up is because those 3 particular diagnoses are the 3 that are the most commonly seen in those that have the potential for a worse outcome. Doesn't mean that they'll have one, but it's important to note. The CDC came out with a recent statistic that said that 94% of the people who died from COVID had a secondary condition that affected their health, with those 3 being the most common. So what I wanted to get into is how to best digest that information, but also how you can best modify it. So blood pressure, diabetes, and coronary artery disease there are genetic factors that play into why you have that, but there also are other factors that play into what you can do to lower your risk and lower the severity of those conditions. For example, if your blood pressure is 130 over 80, it's not too high, but what you can do is make dietary changes, implement exercise, and you can lower your blood pressure to maybe 120 over 80. And so it's a small gap, but something like that can really go a long way in helping to prevent the severity of the case that you have. And this just goes for just general health. Similarly to diabetes, the number you monitor is your A1C or your blood sugar. And so that's another one, lower it a little percentage point or 2. And it's a good indicator of your overall health. So what I want to bring up is one more slide that talks about the exercise component of how you can best lower these modifiable risk factors. So again, high blood pressure, heart disease, and diabetes, they are all factors that your doctor will try and tell you to exercise or eat a proper diet, but you don't always get what you need to do. And so here we have what the CDC and what the ACSM recommend to exercise per week. So you should be doing you should try to reach for 30 minutes of moderate exercise 5 times per week, which would be 150 minutes, or 25 minutes of vigorous exercise 3 times a week to total 75 minutes. And you should combine that with 2 days of strengthening. So it might seem like a lot, but these are what the guidelines indicate would be good for overall health. And so what you can do to make this more manageable is to start small. Do 10 minutes 5 times a week. And you can really work up to what the guidelines say. You could do more, you should do more. But these are what the minimum is that the CDC recommends to try and be the optimal health. And again, we'll answer any questions on maybe what is considered to be moderate or vigorous, if anyone has a question on that. So I'll leave the last little thing I want to say about this is my favorite analogy. So for those of you who aren't people who like to exercise, or you don't really know where to start, my favorite analogy, the best time to plant a tree is 20 years ago, and the second best time is now. So even though you haven't exercised in the past, it's always a good idea to start somewhere, and you'll have a tree in no time. So at this time, I want to bring Bianca and David back on. We kind of wrapped up our information portion, and so I want to bring them back on so we can start to field some questions, as I know we went through a lot of information.
All right. Awesome. Thanks so much, Eric and Bianca. That was very, very informative. I learned a lot just sitting here watching you guys. All right, so let's get into some questions. Reminder, if you have questions, please type them in the Q&A. We should be able to get to a lot of them today. So we'll start off with a pretty general one. Jenny wants to know, what do you consider vigorous exercise?
Sure. So vigorous exercise is when you're, to use the scales we kind of talked about. If you were to on a scale from 1 to 10, say how hard am I working, you're in that 6 to 8 or above range. So if you feel like you're really breathing, you're pretty hard, that's what you're considering vigorous exercise. Additionally, the heart rate, if you're interested in what that should be, again, that correlates pretty well. That's 60 to 80% of what your maximum is. It's a good measure.
Awesome. Bianca, anything to add to that? Or all set?
I think he did a great job.
I think so too.
You're thinking more of those high intensity exercises that leave you breathless. 25 minutes might be very hard to complete. 30 minutes would be more of a relaxed, steady exercise.
Yeah. While we're on the exercise note, another question came in from Jane. Do either of you have any suggestions in exercises that might change because you're a senior citizen?
Yeah, Jane. So I think that some of the guidelines that Eric gave, they're going to be general for a general population, but certainly if you're a senior citizen, going out for a 30-minute, you have to kind of take into consideration the exercise program you were doing before and the exercise program, adapt that and continue building up to that point. If you're a senior citizen, I would definitely make sure you are incorporating some exercise that gets your heart rate up to a moderate degree. And I would also include some resistance training to make sure we're working on strength and bone health.
Awesome.
Yeah, no, I agree. It's tough to, we wanted to, with something like COVID or with anything, it's tough to be cookie cutter with what we give. But we wanted to, the number is something to strive for. Like I mentioned before, something's better than nothing, and doing you could always do more with within reason, I suppose.
Yeah, awesome. We'll keep on the exercise bandwagon. Terry had a question on the 30 minutes of exercise. She was wondering, does it matter if it's aerobic exercise, yoga, stretching? Which do you prefer? Which do you recommend?
So go ahead, Bianca.
The ACSM guidelines are 30 minutes of aerobic exercise 5 days per week. So really anything that's going to elevate your heart rate. So that would probably not necessarily include stretching, but any type of yoga that raise your heart rate a little bit, walking, like jogging, cycling, anything like that. And then those guidelines also do include the 2 days of strength training as well.
Yeah. And, I'll attest to anyone that I can get pretty sweaty in a yoga class. So that definitely fits into moderate, maybe sometimes vigorous exercise.
Yeah, I agree with you, Eric. I sweat watching the yoga class. We had a question from Annie come in. With patients that you guys are treating post-COVID, are you finding a lot of people having setbacks in their strength or muscular capabilities?
Sure, it's very, very variable. I hate to always say that it depends line, but it really does. And so people who've had more severe cases, it's definitely more prevalent to have some weakness in both of your respiratory and your limbs, the limb muscles. And so the best way, the way that we outline this is to give you ways to see if you're incrementally changing. So sometimes it's hard because the symptoms will last for, months on end, but maybe, let's say you caught this in April, and, in May, you still feel symptoms, but if you were to have objective measures, maybe you can see some progress. So to answer the question a little bit better, it's variable, but it's typical.
I will add that we've seen changes in strength and fitness for patients that did not test positive for COVID. We've all gone through a big lifestyle change, and many of us haven't been to the gym in months, maybe have really steered away from our normal routine. So for everyone, it's really important that as we kind of ease back into activity, we're doing it very kind of slow and controlled, kind of keeping in mind a slow progression to your previous level of fitness.
Awesome. All right, we had a couple questions on patients that had COVID a while back. So I'm going to ask Sarah's question. It encompasses a couple other that we received. So Sarah wants to know, what do you recommend for someone who had COVID in March but didn't have any of this information to rehab properly? Sarah's still finding exercise to be quite difficult, and prior to that was a pretty avid exerciser.
Sure. I mean, the guidelines are used to show you how you can progress, and this is based off of the information we have available now. And the journal the article that we took was written in July, so this information wasn't available at the time. So it's important to really listen to your body, stay in the zone where you can tolerate, and we'll have more information. When I say we, I mean the healthcare field will have more information as time comes, but the best thing to do is not to overexert yourself, because there have been some cases where we have seen some harmful effects. So I wish I had a better guideline for someone who perhaps to best answer your question, but I would say kind of staying the course of whatever you can tolerate at this point is probably the best for now.
I'll add to that too. Just be kind with yourself. Continue to add time and intensity. It's a marathon, not a sprint. So thinking about things like adding 5 minutes to your walk, 5 minutes to your jog per week, and just kind of slowly ramping back up to where you are. I will say, even if you're not currently suffering from any of the COVID symptoms, some of that deep breathing can also be really helpful, working on chest expansion if you feel like you're still getting breathless much more quickly.
And just one last thing, if you really are having symptoms that are preventing exercise altogether, it's never a bad idea to get things looked at. You can never be too cautious.
Yeah, that's great. Eric, this is a question specifically to you from Ray. Ray wants to know, you'd mentioned the 50-30 rule, stating that you should start with 50% of your normal volume followed by 30%. Ray's having a little bit of trouble grasping that concept. So if you wouldn't mind explaining that again in a little bit more detail.
Sure. So this is a way to progress back into what your previous level of activity was. And the best way to do that was to depict it by, so this is a 4-week timeline. So week 1, 50% of what you were doing before. Week 2, 30%. Week 3, 20%. Week 4, 10%. To progress each week, you need to be able to do the previous one without aggravating symptoms. And so, it's easy to do the math if you're a runner or someone that works out to a certain number of minutes or hours per week. But for your someone like college athlete or high school athlete, or someone that just plays sports on their own, it's a little tougher. And so what I would say is to use that use time that you play as a metric, and use intensity. And I would communicate these with if you're one of those college or high school athletes, communicate that with your coach that you might need to ramp down the intensity a little bit while you're recovering if you're really still having symptoms. I hope that best answers the question. As 50% of 5 practices is not really, you have to go to some sports practice if you're an athlete. So I would use the intensity scale. So maybe you don't run the sprint trail or something along the lines of that.
Yeah. And Ray, Eric's email is going to come up later. If you have any further questions on that, Eric would be more than happy to talk to you about it offline. Right. We got a question from Annie. Annie refers to herself as a long hauler. She's been sick since April. She's returning to work next Monday, and she wants to know if you guys have any suggestions on dealing with a mask while at work after having COVID. Just to provide a little color, she has to wear 3 masks during some medical cases at a time. So that could be challenging for her.
Well, Annie, we've been incorporating masks in the clinic for a few months now, so I've gotten accustomed to wearing them all day. One thing that I will say is it's really common for people to kind of change their breathing mechanics while they're wearing a mask, almost holding their breath. I'm going to suggest for you to kind of monitor, make sure you have nice even breathing. I would suggest some type of heart rate monitoring as well, making sure you're still taking breaks to drink plenty of fluids. If you have the opportunity throughout the day to be by yourself, taking off the mask for a few minutes, doing some of that deep breathing to kind of down regulate. And I would also just say, all of those tips for pacing yourself throughout the day. It might be difficult on your first day back. So make sure you're taking everything nice and slow.
Yeah. Bianca's the breathing expert on this one, but definitely it's a gradual return. I won't sugarcoat the ease of it, but it does get easier.
All right. Next question. I'm under quarantine and infected. Should I limit my physical activity?
So I think that's going to be extremely dependent on how you're feeling. So some people have much more mild cases and they can tolerate a little bit more activity. I would say during that time, it's extremely important, as Eric mentioned, to be monitoring your breathing, your heart rate, and make sure that you're not pushing yourself too hard. This is a time where rest and recovery is going to be important. But if you can do so safely, you're still welcome to do exercise, obviously, in the comfort of your own home safely. But for some people, that's just not going to be an option. Some people have a more severe reaction and they really need just rest.
Yeah. The guidelines are really for everyone's safety. If you're infected, you want to wait till your symptoms are relatively gone before you start to do anything too intense. It's really to limit the any of those extra cases where you have someone who's rather fit and then has a poor outcome that tried to do too much too quick.
Thanks, guys. We got another question coming in. Will exercise help prevent me from getting the virus?
I think that's a really great question. As Eric mentioned before, there are all these kind of morbidities or other conditions that definitely have a huge impact on the outcomes of COVID. We don't have the research right now to necessarily correlate being more active with having better outcomes, but we do know that there's a ton of health benefits related to exercise. So if you can do so safely, I think it's definitely going to be beneficial for you to stay active during this time.
Yeah, I could probably list off 100 reasons why you should exercise, but definitely you can still get infected if you're exercising. So be cautious when you do so, but it is important.
Yeah. Two questions that are going to kind of go together. So I'll ask one and it'll lead into the next one. I don't have any exercise equipment at home, but don't feel comfortable returning to my gym. Do you have any recommendations for physical activity I can do at home?
I'll give a little plug for our Instagram page. Maybe we have some exercise videos that we have on there that you can use any home, like easy home equipment. 30-minute quick workouts that you can do. I would be creative. There are a number of videos on YouTube. There's a number of exercise videos that you can follow along with. And honestly, we've been doing telehealth for a while. I've had people throw books into a tote bag for weight. I've had someone do some shoulder presses with a wine bottle. So it's get creative.
We certainly have gotten really creative. One of my colleagues did a workout on Spear Live, did a slider workout using a dish towel. You can also use marching in place or dancing, like side steps to get your cardio up. I love putting on music and dancing, just anything that's going to raise your heart rate a little bit. We are just going to have to be like a little bit more creative during this time because most of us don't have a full gym set up in our New York City homes.
All right, we got a couple more questions coming in the Q&A, and we have a little bit more time, so I'd love to be able to get to them. So Ray wants to know, are there better or worse types of wearables, wrist, chest, etc., if we want to track our vitals when returning to exercise months after COVID with a goal for heavy intensity, sprints, heavy lifting?
Sorry, was that to like tech devices for heart rate?
I believe so, yeah.
So I know the most accurate will be ones that connect and wrap around your torso right here. If you want something that's very specific, I don't want to plug or don't have any specific brands that I'd want to advertise, but that's where you'd get the most specific and accurate heart rate. But anything you wear on your wrist, when you use your phone, it's within the realm of error. So I don't think you have to get too fancy.
Yeah, the tech devices are getting better and better. And most of the research says there's not a huge difference and that they might be off by a few, but you'll be able to see those kind of big spikes or drops.
All right. Thanks, guys. We have one last question, and then we're going to close out the webinar. If you have questions, please continue to ask them in the Q&A. We'll be able to answer them after the webinar. We'll be able to answer you privately. So last question. I have trouble exercising for 10 minutes before getting short of breath. How can I get to the recommended amount of exercise?
No.
Oh, go ahead, Eric.
Okay, I'll go quick. I mean, that's a perfect example. 10 minutes. That's your baseline. That's where you're at for now. And whether it's increasing it by a minute, that's you have to start where you are at and bump it up slowly. It's going to be incremental, and again, it may change as we get more information about this. But right now, being incremental and really slowly increasing that is going to be the best way to go, even if it's 11 minutes.
Another suggestion would be you could always decrease intensity a little bit in order to increase the length of your activity. You can also do activity at multiple times throughout the day. So going back to kind of pacing yourself, maybe taking a 10-minute walk in the morning and a 10-minute walk in the evening to kind of build that time over the course of the day.
Yeah, it doesn't all have to be at once. The 30 minutes is for the day. You can, pretend to wake up and go for your walk commute for 10 minutes in the morning. At the end of the day, go out for another 10-minute walk and you hit 20 minutes that day. So breaking it up is another way to do it.
Awesome stuff, Bianca and Eric. Thanks so much for answering the questions and being so thorough today. I hope everybody learned a lot. I learned a ton, so much appreciated. All right, we really hope today's talk was valuable and you learned a few more ways to prevent and perhaps manage some symptoms you may be experiencing, as well as better understand recovery after COVID. If we didn't get to your question, we'll do our best to reach out to you directly afterward. We'll also be sending a handout of the important facts for you to have as a reference. As Eric mentioned, due to COVID, we've been able to successfully integrate telehealth into our treatment model. For those of you recovering from COVID who may be hesitant to venture to the clinic, please know we're happy to treat you in the comfort of your own home. Of course, in the clinic, we're following all of the CDC's guidelines, and our aim is to make sure all of our patients feel comfortable and supported. So just one last thing with Eric and Bianca. Again, Eric's a physical therapist at our Upper West Side location. His email's below. Please reach out to him if you have any specific questions on his talk. Bianca's a pelvic floor specialist and a physical therapist at our Upper West Side location as well. Her email is there as well. Please, again, reach out to Bianca with any specific questions. She seems to be the breathing expert, so I would go to her. You can see myself, Regional Director of the Liberty Region. My email is right there. Again, any questions, any concerns, comments, please feel free to reach out to me. And then Michelle, who is so gracious and kind in the background, helping us answer some of the questions and facilitate the chat. She's the director at the Upper West Side location. So again, you can reach out to her with any inquiries or questions. So just lastly, at Spear, we treat an array of conditions from head to toe. Should you feel that you could benefit from some individualized guidance and treatment, please don't hesitate to reach out to any one of us individually, and we'll personally coordinate you being set up with one of our team members for an evaluation. Thank you all very much for spending time with us today. We hope you enjoyed our webinar, and we wish you all the best. Be well.